I think the biggest challenge that we see in healthcare today is the significant rise in chronic conditions amongst the population. So when you look at the age of the population that is today, there's around 30 million people that have 3 or more chronic conditions, and just the simple aging of the population is taking that over the next 15 years from 30 to 85 or 90. And you have a system in healthcare that is really ill-equipped to handle complex patients. And so when you think about the way hospitals operate, the way data and analytics is shared, it isn't really oriented towards addressing that chronic patient at the point in time when you can actually impact care. And so the system needs a pretty significant overhaul to handle this cost. And it comes at a time when hospital systems are virtually zero profit. And so they're scrambling for every dollar they have to invest in any technology or other ways to improve their ability to do it. And a government that is seeing increasing pressure on the Medicare program, where the aging of the population is going to cause that program to maybe run out of money in the next 15 years. And then the last piece is that the consumer is now bearing more and more of the cost of their own individual health care. And so if you were to go back about 10 years, what you would find is that healthcare spend and spend on things like communications was roughly the same for a household. And now healthcare is twice as much as the spend on communications. And everyone can think about how much money they spend on their cell phone and other things. And yet healthcare is twice as expensive now. And so all of those factors together creates a very difficult environment to address this incredible expansion in folks with chronic conditions. And that, I think, is the largest problem we face today. Well, I think the biggest opportunity is to figure out how to engage those consumers in ways that they haven't been engaged in their health before. I mean, I remember I was listening to a comedian not that long ago who said, well, look, if I have brain cancer and the doctor tells me to go do something, I go do it immediately. But if my doctor tells me I weigh too much and I should go lose weight, he's like, I'll see you again next year, right? And so the consumer is engaged in their health only at a time when it's absolutely imperative for them to be that way. And usually that is way too late to actually avoid a lot of the significant spend associated with caring for themselves. And so I think the biggest opportunity for us today is that there are ways now to interact with folks that are a lot less expensive and a lot less intensive on the interaction, and yet could offer the opportunity to really keep people healthier and avoid long spend at the end of their life. And so one of the things I think the healthcare system needs to do is to figure out how am I going to change the way I treat a patient, both in terms of my actual medicine as well as just my simple interactions in light of that. So my simplest example is, last year I went to get a physical, as everyone hopefully has been doing, and the first thing they did is they took my pulse. I said to them, look, I have an iWatch on my arm. It has been taking my pulse every minute of the day for the last year. Why don't you just download what's on my iWatch, right? And so the fact that they're still taking my pulse is a little representative of how little they've used the new tools at their disposal to monitor my health and to engage with me. And so I think that's where the opportunity exists with the consumer, is to change the way they think of health from these discrete transactions that you have with them and to make it more of a perpetual relationship. Yeah, so Optum has spent a lot of time and focus on figuring out what is our consumer interactions now going to look like. So one of the things you're seeing with Optum, as you remember, I talked about chronic condition issues. And so Optum has launched into an effort to rethink how we manage chronic conditions. And one of the most important elements of that we've called consumer engagement. So if I'm going to manage somebody who is a cancer patient, how do I engage with that member, not after they've begun chemotherapy and had chemotherapy for 6 weeks, but the day they got diagnosed with cancer? And what does that interaction look like? Is it going to be what it's been in the past, which is either an interaction with a doctor face-to-face or a phone call from a nurse from a phone bank to manage that person's care? Or is it going to be a whole bunch of interactive tools that you can use to help treat that patient and encourage that patient to do things around how they eat, what other additional steps they need to take to treat themselves, what their drugs might be doing to them? What are the ways that you're digital interactions can have with that consumer so that they better understand their care and they better adhere to the care they're getting. So at the core of what we're trying to do is actually data and analytics. And so what Optum believes is that one of the fundamental problems in healthcare is that the provider at the point of care isn't fully aware of what choices to make based on the full understanding of the patient and a rich data analysis of what are the things that they can do. And so what we're trying to do is we're trying to take information that we get because we work with payers who actually see every interaction you have with the health system. And we also work with providers who help us by giving us some of their clinical information. And we're able to marry the two together and then run a series of algorithms that say, based on your condition, here is things that should be done to treat you better. So as an example, I'll go back to cancer. So we can look at people who have a very similar cancer diagnosis as you and all the different ways that doctors in all of the different places in the country have treated them. And there are different treatment paths that you can go down. And we have an ability to figure out which one of those paths is less expensive, like not just on an episode basis, but across the entire cancer journey they're on, and also more effective. And so but being able to provide that data to the doctor at the point of care is the key. And so that data and analytics, which leverages things like you're talking about, natural language processing and AI and those other tools, is at the core of that. And the challenge for us is not just to do the analysis, but then to get it to the point of care where the doctor's actually making that decision. So Fuqua prepared me in lots of ways. I think there's two really main elements that I got out of being here at Fuqua. One is it's a very broad education that you get at Fuqua. And so I had the opportunity to take statistics, accounting, macro and microeconomics, and then a series of other disciplines, finance, et cetera, that really gave me a full view of how companies are run and are effective. Because some of the issues we deal with in healthcare are operational in nature. And some of them are marketing in nature, and some of them are finance in nature. And so though there is a core in healthcare of topics that we're working on, it's the broad understanding of how all of those things go together. So that if I'm trying to engage you and I've got a great marketing program to interact with you, and yet my operational people can't do a good job of doing that, or we drop the ball on how we implement a program, it doesn't work. And so that broadness of the education, I think, is critical. But the other thing that I think is really important about Fuqua is it really just helps teach you how to think about business. So separate it from the specific course matter that you're taking, whether it's operations or marketing or finance. And it's just a discipline that I found around how do I approach problems and how do I begin to solve problems that are complex and not specifically laid out for what's the recipe to fix this problem. And I think Fuqua did an excellent job, and I think it does today do an excellent job of helping you understand how to solve complex problems when you don't know the answer ahead of time. Unlike many other industries, taking care of an individual is fragmented across a number of providers, the payer or plan sponsor responsible for them, retail locations that they interact with, and all of these touch points historically have been very uncoordinated. And that has caused part of the problems that we talked about in terms of increasing cost of care and difficulty in managing a patient's condition. And so what partnerships allows us to do, and I think the industry to do, is to get those touch points to act in a more coordinated fashion across the whole system. And so as an example, one of our largest competitors is CVS, who has a pharmacy benefit manager just like Optum does. But it happens to also be one of our largest trading partners because millions of our members go to CVS every day to fill their prescriptions. And so one of the things my team does, and Optum does in general, is think about how do I reach into the CVS environment, which is an important touch point for that consumer around their health, and help impact care. And so impact care can be things like they're showing up to fill a prescription, and it might turn out there is a significantly lower cost drug that they could be on. If the pharmacist knew about that, they could work to switch that prescription right there. We could look at all of the drugs that person's taking and look at things like, should they be taking these two drugs at the same time, or are there some significant adverse interactions? Are they adhering to their drugs? So I know they got the prescription, but did they actually fill the prescription? And then, of course, they're in there picking up diabetes medication, but are they on a diabetes management program with one of our disease management programs? And all of these things we can do by reaching into the CVS store and addressing those concerns with the consumer. But of course, without a partnership to do that, it makes it very difficult to do. Likewise with a provider or a hospital that consumer may show up at. And so we partner with those organizations, even though they're competitors of ours, because it improves that overall cost of care management and it improves the quality of what we're able to do. And so that's why this ecosystem, which has been historically super fragmented, is now working together with some of these partnerships.